Dr. William Raszka. He's a pediatric infectious disease specialist at the University of Vermont's Lana College of Medicine. He joins me from Burlington in the United States. Doctor, we really appreciate your time. Now, you believe that children should be going back to school, and you've spoken about how it can be done safely. Just talk us through your reasoning on this issue.
Well, I think that schools are the best place for children. I think that it's really important for their academic, emotional, social, and physical development. Now, I've always said, however, that it needs to be done safely and that you have to take into consideration the local prevalence rates and the mitigation procedures that are put in place into school. So there's no single blanket policy. I'm not in favor of saying that all children need to return to school immediately. I think you have to base your decision on the epidemiology and what you can do in your local area.
So in local areas, what would you be pushing forward as advice? I mean, some countries we've heard have got social distancing measures. Some are enforcing the use of masks. What are your suggestions on this issue?
So I think there are four major strategies to help children get into school. One is to control the community prevalence rates, that schools are not independent of the community. So if there's widespread community transmission, there will be presumably transmission in school just because people are moving back and forth between the community and the school. Second, that we should just make sure that we don't allow the virus to enter the school. So there should be some sort of screening procedures. In the United States, we'll probably rely on symptoms and temperature screening, whereas in Germany, they may actually rely on antigen testing and other strategies. And there should be a whole panel of mitigation strategies that schools can use to prevent transmission in the school. So it could be physical distancing, masking, pod-based learning, staggered start and stop times, avoiding crowding in interior spaces such as gymnasiums and cafeterias. And that the final bit of the strategy is to identify anyone who is infected and do contact tracing so that there is not ongoing transmission. And particularly in low prevalence areas, this seems to work well. We have lots of data from schools that have opened in Western Europe with a variety of mitigation strategies and low prevalence rates of community that have reassuring data.
And I would think that this would also depend on the ages of children, because obviously if you've got 6, 7-year-olds going back to school, it's going to be very different to high schoolers and getting them to social distance and use masks, etc. But just take us through what the science says about the impact the virus has on children and transmission by children in schools.
So there are three things that we've been saying for a little while. One is that children seem to be less likely to be infected. That's not as huge a difference as it used to be in the United States, but around the world, children are still underrepresented. Two, children are much less likely to develop severe disease. Everyone is fairly confident about that, although children can develop bad disease, much less likely. The transmission data is really interesting because it's been really hard to do a controlled study of how infectious a child is, and people are trying to link PCR data with infectivity, and that's not quite right. What we do think, though, is that generally speaking, children are less infectious than adults. And I think this is a continuum. The younger children are less likely to transmit the disease. Older high school students, as we define in the United States, are much more similar to adults. But we have household context studies in multiple areas of the world where they have showed that children, particularly younger children, are much less likely to transmit the virus. We have school opening data that also in Ireland, in Australia, and France, and Germany, and the Netherlands was suggesting, again, low transmission rates in school, particularly from younger children. But high schoolers, I am much more careful. I really want to make sure that they're masked, that they are physically distancing.
Dr. William Raszka, thank you so much for your time. It's great to get your take on an issue that's affecting billions around the world. Thank you.
My pleasure. Thank you.